Hello, I am Chrissy Barron, and this is my video about generalized anxiety disorders. I'm going to be talking about generalized anxiety disorders and referring to them as GAD, G-A-D. And this is as explained in the DSM-5, which is the Diagnostic Statistical Manual in the 5th edition. You can find the full description in the DSM-5 on page 222. Now, my main reason for choosing this disorder is because I myself suffer from an anxiety disorder. And before I knew more information about the symptoms, I didn't really understand what I was feeling. I thought that it was normal, right? Because you're a busy adult living a life, having a job, going to school, whatever. And my goal with this is to bring more awareness into society for mental health disorders, because if we can bring more awareness and share symptoms and share stories about successes, hopefully it'll be able to help someone that's going through this that doesn't know any better of what they're experiencing or the symptoms they're experiencing. So that's the main reason that I chose GAD. So the diagnostic criteria for generalized anxiety disorder. Now, diagnostic criteria is the criteria needed for a diagnosis. So I'm going to go down the list and let you know what those are. So we have the presence of an excessive anxiety or worry, and this can be seen through a variety of topics, events, activities. Now the worry needs to occur more than not for at least 6 months and is clearly excessive, okay? The worrying must be present when nothing else is wrong. And now the worrying in adults is going to be different than the worrying in children, right? So the worrying can be seen in adults through job responsibilities, financial responsibilities, family health, that person's health, whereas the worrying in the children is going to be seen through their abilities in the quality of their performance. So through school, through sports, through any activities that they're doing, okay? Now the anxiety and the worry is associated with at least 3 of the following physical or cognitive symptoms. However, in children, you only need 1 symptom to get a diagnosis, okay? So the symptoms are edginess or restlessness, tiring easily or fatigue, impaired concentration, where you feel like your mind just goes blank, irritability, increased muscle aches or soreness, and difficulty sleeping. And this can be falling asleep, staying asleep, just feeling inadequate sleep, really. Now, many individuals with generalized anxiety disorder also experience nausea, diarrhea, and sweating. The anxiety, worry, or associated symptoms need to be carried out on a day-to-day of activities and responsibilities. So it's affecting their day-to-day life. This may cause problems in their relationships, their jobs, anything that's really important to them. And these symptoms need to be unrelated to any medical condition. So this means that they're taking any other recreational drugs, or they are taking prescription medications, or they have a substance abuse. So that needs to be figured out in the first assessment. And these symptoms are not better explained by a different mental disorder. So that is a criteria for diagnosis of generalized anxiety disorder. Now, an accurate way to assess for GAD is through a diagnostic interview. And an example of that is the structured clinical interview for DSM disorders, or the anxiety and related disorders interview schedule. While trying to understand the nature and intensity of the client's anxiety, the clinician can always ask for self-reported questionnaires. An example of that would be the Generalized Anxiety Disorder Scale -7 or the Hamilton Anxiety Rating Scale HAM-A. Now the HAM-A features both psychic and somatic anxiety subscales, and the rating has actually become an industry standard in clinical trials of pharmacotherapy and psychotherapy for GAD. An example of serious versus moderate can be defined as a recent suicide attempt, substantial work limitations, substance dependence, or 30 or more days out of role in the year, whereas moderate can be defined as a suicide gesture ideation, substance dependence without a serious role impairment, or a moderate work limitation. Now, the diagnosis, if it does not meet severe or moderate, will be classified as mild. The two main treatments for generalized anxiety disorders are psychotherapy as well as medications. And one of the most effective forms of psychotherapy is cognitive behavioral therapy. Now, this includes teaching the client specific skills to combat their anxious thinking. And the reason that this is so successful is because it gives the clients the power to be in control of their recovery. Now, through that power, it is explained as reading about the diagnosis, completing homework assignments, teaching the client the skills to practice and see improvements in their anxious thoughts. The benefits of cognitive behavioral therapy are typically seen from 12 to 16 weeks of sessions. However, this does change per client. The other types of methods are exposure therapy, acceptance and commitment therapy, dialectical behavioral therapy, interpersonal therapy, and eye movement desensitization and reprocessing. Now, along with the psychosocial treatment is a pharmacotherapy treatment for generalized anxiety disorders. Pharmacotherapy refers to treatment through medication. There are several types of medication that are used to treat generalized anxiety disorder, and those are selective serotonin reuptake inhibitors, SSRIs, serotonin norepinephrine reuptake inhibitors, SNRIs, benzodiazepines, and tricyclic antidepressants. Now, all of these need to be prescribed by a physician, and the benzodiazepines are really used more as a sedative for relief from the anxiety disorders, and they can be habit forming. So I think that's important to keep in mind. Now, researching generalized anxiety disorder has enhanced my overall understanding, but really, it has helped me in my ability to regurgitate the information and explain it to someone else. And I think that's what's most important, is to truly understand it and be able to explain it to someone else if I see that they may be having these kind of symptoms or experiencing. Now, to summarize my main points, we went over generalized anxiety disorder, gaining assessment of the client through questionnaires such as the Hamilton Anxiety Rating Scale, and treatment of the disorder that has been proven to be most successful when combining psychosocial is an example of cognitive behavioral therapy and medication prescribed by a physician. Thank you.